And drug policy advisor and attorney Mike Barnes is joining us now. He was the confidential counsel in the White House Drug Policy Office and provided direction on policies aimed at reducing substance abuse. So, Mr. Barnes, thank you for taking the time to be with us today. We really appreciate it.
My pleasure, Christy.
Let me ask you first and foremost, how easily available are these drugs, not just to people in the medical profession, but to any old Joe Schmo?
These drugs are not available without a significant number of restrictions on them. The first and foremost is that you have to have a prescription. Even propofol is regulated by the FDA that it requires a prescription, and it can only go to medical practitioners. The other types of controlled substances that we're talking about are at a higher level where they're regulated not just by the FDA but also by the DEA. And so in addition to basic record-keeping requirements that practitioners have, there's also these affirmative reporting requirements that go back to the DEA, so there's a much higher level of scrutiny for this chain of custody, this distribution process for controlled substances.
So could Michael Jackson's death, do you think, have been avoided?
You know, I can't say with certainty, but I can say that there are some state laws that could certainly intervene and prevent more tragedies like this from happening. California has already changed its law, by the way, so that it now requires dispensers of controlled substances to report that dispensing to the state prescription monitoring program. And I think 35 states now have prescription monitoring programs. Some of the best practices of these programs could be put into effect to prevent similar sorts of tragedies. So in addition to the dispensers actually reporting to the prescription monitoring program, the medical practitioners who are prescribing also need to check it to make sure that people who they are prescribing to are not actually already receiving similarly powerful substances from other prescribers. And then there's also another best practice called red flag reports, where any sort of data that's like out of the norm could actually send a signal to public health officials and let them know to investigate that this prescribing seems a little bit off.
But would what Dr. Murray would what he was requesting from pharmacist Tim Lopez, would that have been a red flag? Or would those have been normal levels that you would have assumed for an entire practice somewhere else, not necessarily obviously for one person?
Right. The quantities that you're talking about, as far as I understand, were for about thousands of people, you know, well into over 1,000 people who would be using that amount of propofol. But you point out an important question of these state laws, that you need to have interstate data sharing. So Nevada would have had to share its information with California and vice versa. That's another best practice that states need to implement in their prescription monitoring programs. But what I'm talking about are the other controlled substances, those anti-anxiety medications. And we're hearing from the defense that they believe that Michael Jackson had some sort of Demerol addiction, which is an opioid pain reliever. We also know that Michael Jackson was taking anti-anxiety medications. However, he got these pills, these 8 pills that the defense is describing now as Michael Jackson having taken himself secretly. That all would have been in a prescription monitoring program and could have led to a red flag report from public health officials.
Okay. Everyone talks about how propofol should have been used in a hospital setting. I mean, there's no doubt that is the one thing that everybody is on the same page about. But it's not illegal. It doesn't sound like what Dr. Murray did in terms of, I mean, ethically, yes, but legally, it doesn't sound like him practicing using this outside a hospital setting was black and white illegal. My question to you is, should it be?
Well, I do know that the Drug Enforcement Administration has recommended that propofol now be scheduled as a controlled substance so that it would be subject to those greater restrictions, and therefore, obviously, including in that, would be subject to the state prescription monitoring program requirements as well. But, you know, I don't know necessarily that this is sort of a problem that exists in great
quantities,
yes, thank you. Because, you know, this is so extreme, this is so bizarre behavior on behalf of a practitioner that he would actually take this into the setting and against all the warnings associated with the medication on its label, against general standard medical practice. We heard from the other medical practitioners, it's just unheard of. So, you know, I think it could certainly be beneficial to restrict the access in a greater way by scheduling the propofol as a controlled substance, but I don't think it's going to fix a big problem. You know, it's just sort of a really bad situation with this instance, but it's not common.
So if he's not convicted, do you think that Dr. Murray should have his license yanked?
I do. I'm hoping that he will be convicted just because of the egregious nature of his actions. And I do think that it's imperative that there be justice for the family and the fans of Michael Jackson. And if not, it's going to really undermine a lot of people's credibility in our system of justice. But at the very least, yes, he should not be permitted to practice medicine because he doesn't take the adequate precautions that are necessary to keep his patients safe. And the medical board is responsible for ensuring that patients are safe, that licensed medical professionals are actually following the standards of care and the best practices. And in this case, he certainly has a long history, with Michael Jackson at least, of not doing so.
Drug policy advisor and attorney Michael Barnes. Michael, good to have you on the show today. Thank you for sharing your insight with us.
My pleasure.
Sure. Now, I want to get you back in